Most people don't realize this, but a simple irritation on the head of the penis could be the first warning sign of something far more serious happening inside your body. And right now, thousands of men are ignoring it, brushing it off as nothing, until it turns into pain, infection, or even long-term damage. In the next few moments, you'll discover the critical warning signs of balanitis that most men completely overlook, the hidden causes doctors often don't explain clearly, and exactly what your body is trying to tell you before things get worse. Here's a statistic that should stop you cold. Nearly 1 in 10 men will experience balanitis at some point in their life, but the majority won't recognize it early enough to prevent complications. I'm Dr. Jake Miller, and after more than 20 years of treating patients, I can tell you this. Here's the truth nobody tells you. This is something most men will never hear from their own doctor, because by the time they show up, the condition has already progressed. Let's start with the first sign most people ignore. Most people notice redness or slight irritation and assume it's just poor hygiene or temporary sensitivity. That assumption is exactly what costs people their health. Here's what's actually happening inside your body. Balanitis is inflammation of the glans penis, the head. This inflammation is often triggered by an overgrowth of bacteria or fungi, especially Candida. When the natural balance of microorganisms is disrupted, your skin reacts. It becomes inflamed, swollen, sensitive. Here's the critical detail that separates this from simple irritation. First, the redness doesn't go away after washing. Second, the area may feel warm or slightly painful. Third, you may notice a shiny or tight appearance of the skin. And fourth, there may be mild itching that keeps returning. If you're seeing persistent redness that doesn't improve in a day or two, that's not normal irritation. That's a conversation you need to have with your doctor this week, not next month, this week. Now you know about redness, but the next symptom is more dangerous. Most people notice a white or unusual discharge and assume it's just sweat or poor cleaning. That assumption is exactly what costs people their time and allows infection to spread. Here's what's actually happening inside your body. When fungal or bacterial organisms multiply, they produce waste byproducts. These appear as thick, white, sometimes foul-smelling discharge under the foreskin or around the glands. Here's the critical detail that separates this from normal buildup. First, the smell is stronger than usual. Second, the discharge returns quickly, even after cleaning. Third, it may be accompanied by a burning sensation. Fourth, the skin underneath may appear raw or inflamed. If you're noticing discharge that keeps coming back, that's not hygiene. That's your body signaling an active infection that needs treatment this week, not later. That insight could change what happens at your next appointment. But the next symptom, this one has a body count. Most people feel itching or mild burning and assume it's just dryness or friction. That assumption is exactly what delays treatment. Here's what's actually happening inside your body. The inflammation triggers nerve endings in the skin. These nerves become hypersensitive. That's why even light touch can feel irritating or painful. Here's the critical detail that separates this from simple dryness. First, the itching intensifies over time. Second, it becomes worse after urination or sweating. Third, scratching provides only temporary relief. Fourth, the area may start to crack or peel. If itching keeps coming back stronger each day, that's not dryness. That's inflammation progressing deeper into the skin layers, and that's something you need to address immediately. Before we go further, I need you to understand one thing. Balanitis doesn't just appear randomly. There's always a trigger, and if you don't identify that trigger, the condition will keep returning again and again. Now let's talk about pain during urination. Most people feel a slight sting and assume it's dehydration or something minor. That assumption is exactly what allows the condition to worsen. Here's what's actually happening inside your body. The inflamed tissue around the urethral opening becomes sensitive. When urine passes over it, it causes a burning sensation. Over time, this can lead to swelling that partially blocks urine flow. Here's the critical detail that separates this from simple irritation. First, the burning is localized at the tip. Second, it happens consistently, not occasionally. Third, you may notice difficulty starting or maintaining a steady stream. Fourth, the discomfort lingers after urination. If urination becomes painful or difficult, that's not something to ignore. That's a sign the inflammation is affecting deeper structures. You need medical attention this week. Now, you might be thinking this is manageable, but the next symptom changes everything. Most people notice tightness in the foreskin and assume it's temporary swelling. That assumption is exactly what leads to a condition called phimosis. Here's what's actually happening inside your body. Chronic inflammation causes the skin to lose elasticity. Scar tissue begins to form. This makes it harder, and sometimes impossible, to retract the foreskin. Here's the critical detail that separates this from normal tightness. First, the foreskin becomes increasingly difficult to pull back. Second, you may feel pain when attempting to retract it. Third, cracks or small tears may appear. Fourth, hygiene becomes harder, worsening the condition. If you're experiencing tightening that's getting worse, that's not temporary. That's structural change. And once scar tissue forms, treatment becomes more complicated. Hit subscribe right now if you're not already here, because what I'm about to share next is something most men never hear, and it could save you from long-term damage. Stay with me through all of these, especially the next one. That one has never once been on any typical list. Most people experience recurring balanitis and assume it's just bad luck. That assumption is exactly what hides a much bigger problem. Here's what's actually happening inside your body. Recurrent infections are often linked to underlying conditions like diabetes. High blood sugar creates the perfect environment for fungal growth. It feeds the infection. Here's the critical detail that separates this from isolated cases. First, the condition keeps returning after treatment. Second, symptoms appear more severe each time. Third, healing takes longer. Fourth, you may notice other signs, like increased thirst or fatigue. If balanitis keeps coming back, that's not coincidence. That's your body pointing to an underlying issue that needs investigation immediately. Now you know the hidden connection. But the next one, this is where it becomes life-threatening. Most people ignore severe swelling or intense pain, hoping it will resolve on its own. That assumption is exactly what leads to emergency situations. Here's what's actually happening inside your body. In rare cases, untreated infections can spread. Bacteria can enter deeper tissues, leading to conditions like cellulitis or even systemic infection. Here's the critical detail that separates this from mild cases. First, the swelling becomes significant. Second, the pain is constant and severe. Third, you may develop fever. Fourth, the skin may change color or develop ulcers. If you're experiencing these signs, that's not something to monitor. That's an emergency. You need immediate medical care within hours, not days. Right now, as you watch this, there are men sitting in their homes thinking their symptoms are minor, while the condition silently progresses. And here's the part nobody tells you. While you were treating the wrong thing, using creams that don't work, ignoring early signs, this condition was buying itself more time. Before you close this video, I need 60 more seconds of your attention, because this is where everything comes together. Early detection of balanitis means simple treatment, basic hygiene changes, targeted medication, fast recovery. But late detection? That's where complications begin. Chronic pain, recurring infections, structural changes, even surgical intervention in severe cases. So here's exactly what you need to do. Write down every symptom you recognized while watching this, every single one. Call your doctor and read that list out loud. Don't summarize it, don't minimize it. Read it exactly as it is. Ask specifically for a physical examination and, if needed, tests for infections or blood sugar levels. And remember this, you're not being difficult. You're being the only person in that room fighting for your health. If this video opened your eyes, hit like, subscribe for more content like this, and share it with someone who might be ignoring these signs right now. Because there's something I didn't tell you. There's a specific combination of just 3 of these symptoms that dramatically increases your risk of complications. And in the next video, I'm going to show you exactly what that combination is.